On today's session, we will be covering various aspects of the menopause transition. We will discuss the various stages of menopause, understanding the menstrual cycle, diagnosis and symptoms of menopause and its impact on long-term health, as well as what is the choice and options that women have for managing these symptoms, both hormonal and non-hormonal. And we are completely delighted to have Vikram share his knowledge with us on these topics. So, Vikram, let's start with the stages of menopause. As you're aware, Tara Cares is doing international research with women in lived experience of menopause. And one of the things that women are often confused with is the terminology that's used to describe menopause. Could you help us demystify the various stages of menopause transition? And for our viewers, for the purposes of today's conversation, we are discussing the use case of a naturally healthy woman because we know there are different types of menopause. So Vikram, over to you.
Thank you, Jyoti. And it's interesting to see the data that's coming out of the Tara Care research, both in terms of people's experiences, but also the wide range of or variation in experiences they're having with their menopausal transition. Well, if we start with the types or stages of menopausal transition, then let's focus, as you said, on the natural menopause first. So it's expected that most women will go through perimenopause, which is the first sign of hormone fluctuations around the age of 45 to 50. But that's mainly for the Western world, and we'll come later on in the discussion about when does menopause happen for each individual. But generally, the perimenopause is the first stage that women will experience some changes to their menstrual cycles, some menopausal symptoms, as well as their hormones will fluctuate in the blood. And for majority, that will be 45 to 50. Now, what was happening before this was that a woman would generally have a very regular menstrual cycle. Periods will be very regular, and there will be no symptoms of menopause. And again, we'll touch upon symptoms a little later. After 50 or 51, women will stop periods, and the symptoms will either become pronounced or they will continue to bother the woman. So this is when we say menopause has happened. So from perimenopause, which was going on for a few years, you then have menopause, which is like a finite point. Now, it's always a retrospective diagnosis because you can't say a woman has attained menopause until she has been period free for at least 12 months. So sitting here, I can't say if you're going to be menopausal or you're not going to be menopausal to a woman unless I know her period history. And it's 12 months of not having periods. That's the point we say, yes, this is menopause now. And from that point on, that 1 year of absence of periods until the end of her life, the entire phase is post-menopausal. So those are the three key terms which are sometimes confused. The perimenopause, when things are going up and down. Then you have menopause, 1 year of absence of periods. Post-menopause, right from that point on until end of life.
I think the next related subject, and you touched on it a little bit, is the timing of menopause. You know, it's a controversial topic. We've seen women say that they were dismissed by their healthcare provider because they were felt that it was too young for them to be experiencing those symptoms. Could you help bust some myths and the importance of individual differences and factors? You know, you mentioned one, the period history. Could you help us demystify that a little bit, and so that our viewers can be aware of some of the important key aspects about when these transitions could start for them?
So it's a key observation that age at menopause differs across the world's different populations, ethnicities, and to be honest, we still don't fully understand why that happens. So one has to be honest to say we're not there yet in terms of scientific research, and a lot is still yet out there to be known. What we know is for most Western populations, Caucasian population, the average age at menopause is around 51. And a range of normal age of menopause would be anywhere between 45 to 55. So it's about those 10 years. Now, that's true for Western population. If you look at African populations or Southeast Asian population, Indian, for example, where there have been some long-term and large studies, it looks like the age at menopause is almost 5 years earlier, which is around, say, 46 or 47. Now, other populations may still have other age at menopause, and we still have to do more research on that. What transpires is, why does this happen? So this is mostly down to genes or ethnic variation. And that's because many of the daughters find that they have menopause at a similar age to their moms. It's not 100%, but generally that's the rule. So it looks like there is a heritability or genetic tendency that determines when the age at menopause would be. But of course, there is influence from other factors. So we know, for example, socioeconomic background, nutritional status, whether a woman smokes or not, whether she's exposed to some toxins at her workplace, the environmental stress, all those could have some or a little or more bearing on the age at menopause. And therefore, there are still factors out there which probably haven't been discovered how much impact they have, but we know that it's not just the gene, but a bit of environment can also have an influence on the age at menopause. Now, just two more points to raise there. Women between 41 to 45 who have menopause in that age group must stop periods completely. We term that as early menopause. So anywhere between 41 to 45 is early, which will happen to about 10% of women. And women who have menopause before 40, that's premature menopause or premature ovarian insufficiency. And as you rightly said, there's no age where menopause is too early to happen. So we see girls soon after puberty or women in 20s and 30s who sometimes get diagnosed with premature menopause. It's very challenging. It's a very difficult diagnosis to handle at such a young age, has lots of implications for future health and fertility. But it is uncommon, maybe 1 in 1,000 at the age of 30, but it can happen. And so it's really important to make sure that the diagnosis is done early so that these women get the right help and support.
Right. And I think related to that, Vikram, as you mentioned, like for the Indian population, for example, it happens 5 years earlier. Now, it's important to break that down for our viewers that if your menopause is, say, happening at 45, that's 1 year of period free, which means if we consider just the simple math of 7 to 10 years transition, you may start seeing and experiencing these symptoms in your mid 30s, right? And we've been interviewing quite a few women who were absolutely shocked when they started experiencing these symptoms right after their first pregnancy. I mean, we are in a day and age where almost feels like around 32, 34 women start thinking about having their first child. And for us at Tara Cares, it's so critical that we empower women with this knowledge because they may have to reevaluate their reproductive decisions, if they want to extend a family. So that was very, very helpful. I guess there are 2 points there. When women talk to us about the clinical terminology in diagnosis, so you clearly explained, what's early menopause and what's premature menopause or premature ovarian insufficiency. There are two more terms that women come to us with: surgical menopause or medically induced menopause. Could you help us understand that a little bit for our viewers?
As the term implies, surgical menopause would be anything that involves removal of ovaries. So when the ovaries are removed, whether because of a benign tumor, a malignant tumor, an endometriotic cyst, or any other pathology such as a big abscess or infection, something that's pathological with ovary, where you have to remove both ovaries, that would put women straight into menopause, which can be one of the most severest forms of menopause because it happens suddenly. That is surgical menopause. While medically induced menopause could be any medicines, and it's usually cancer treatment, such as chemotherapy, or other forms of treatment, such as, for example, radiotherapy or embolization, which is a radiological technique. All those sort of treatments can damage ovaries, damage the eggs, stop hormone production. That's when we say this is medically induced menopause. So those two can happen at any age, though. So any woman who is still having some ovarian function, still having periods, still having hormones, suddenly the hormones will stop because of either medication or the surgery, and those two are the iatrogenic or medically induced forms of menopause.
Great. And so is the removal of uterus, can that lead to a surgical menopause as well, or is it just the removal of ovaries?
The removal of ovaries, because it's the egg activity and the hormones from ovaries which maintain the hormone function. Now, it's a very interesting question you ask, and the reason is that some women will simply have a hysterectomy, which means removal of the womb and not the ovaries. Let's say they have fibroids, or they have uterine tumors, or they bleed a lot, have had heavy periods, menorrhagia, and they have to have their womb removed. Does it impact the ovary? The answer is yes. So it is seen that if you've had a hysterectomy, although your ovaries may have been preserved, there is some interference with the blood supply in the pelvis to the ovaries. And that means you may enter menopause earlier than what you were destined to genetically, because the ovaries get somehow influenced by the removal of the uterus and the changes to the blood supply. So you find many women entering menopause within the first 1 to 5 years after hysterectomy. And that's influence of the surgery. So although directly removing uterus is not causing menopause, indirectly though the surgery has some influence.
And that's exactly why I asked that question, because the women say, oh, I'm just getting my uterus removed, my ovaries are still intact. So, unfortunately, sometimes those conversations are not happening between the healthcare provider um, and the patient. So we wanted our viewers to be aware of it through this session. Amazing. So Vikram, thank you so much for in very clear, simple, non-clinical language, which is important for our viewers to understand what are the various stages of menopause. Because for us, there's a lot of information, but then there's even greater misinformation around the various stages, given the amount of attention there is in social media. So this was very useful. The next topic that we are going to cover with Vikram today is the menstrual cycle.